Gates Foundation suggests that preventable risk factors are linked to nearly half of all cancer deaths nationwide. We're talking about smoking, alcohol, and obesity. Joining me to explain the significance of what researchers discovered is cancer specialist Dr. Charles Chaw with Hartford Healthcare St. Vincent's Medical Center. Doctor, welcome. Thanks for being with us.
Thanks for having me.
Great to have you. So, were you surprised about these findings?
Well, this is a very large, comprehensive study by the Gates Foundation looking at over 4.5 million cancer patients and whatever preventable risk factors that they may have. And I'm used to talking to my patients about the fact that the majority of the time we don't know what's causing any particular cancer. But in this study, they found that actually nearly half of all cancers globally had some risk factor that was potentially preventable. And that is a bit of a shock to me and I think to most patients.
All right, doctor, we hear a lot about smoking and obesity, but not much about alcohol as much as a risk factor for cancer. Should more of us be more mindful of alcohol amounts consumed?
Well, that's another thing that's surprising is that most patients don't understand that alcohol is a carcinogen. There's a small heart healthy effect to it, and I think people tend to focus on that, but there's other ways and medications that we can use to treat the heart without using alcohol for its heart healthy effects. But really, even a single drink per day increases your risk for particular types of cancer, such as breast as well as esophageal cancer. And colon cancer is another cancer that is attributable to alcohol. The more you drink, the more your risk increases, and particularly with cirrhosis and liver cancer, there's a number of different diseases, not just cancer, that can be created or affected by your alcohol intake.
Did researchers find that both men and women experience the same risk factors?
Well, smoking and tobacco use leading to lung cancer was the #1 type of preventable cancer for both males and females. For men, they tended to drink a little bit more and they had alcohol-related cancers more so than women. Women, particularly in lower-income countries, had a higher rate of cervical cancer attributed to unsafe sexual practices or inability or access to vaccinations against HPV. But overall, the big three were smoking, drinking, and being overweight. And that's something that oftentimes, unfortunately, comes in all the same package in the same patient. And those patients are in particular risk for developing cancers.
All right, doctor, final question. What do you recommend to your patients to lower their risk of cancer?
Well, I think we have to be careful about not blaming patients for their behavior. And I think a lot of these are environmental factors and also government programs that need to be focused on screening for patients for colon cancer, for lung cancer, as well as mammography. And for cervical cancer also, making sure that our kids get vaccinated. I think that overall it's really just healthy living, good diet, exercise, the common sense sorts of things to prevent cancer.
All right, doctor, thank you for your time. Great information. Dr. Charles Chaw, specialist at St. Vincent's Medical Center with cancer. We appreciate your time. Thank you.
Thanks for having me.